Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is BC's COVID-19 briefing for Monday, May 18th, Victoria Day in Victoria. I want to just start by acknowledging the very difficult, terrible events yesterday in Kamloops. As we all know, the Snowbirds were part of a national tour called Operation Inspiration to really recognize and support Canadians at this difficult time. The idea was to lift our spirits, and what happened yesterday was awful for all involved. We know as a result of the crash that Captain Jennifer Casey passed away, and we send out our condolences, really the sorrow of everyone in BC, from Kamloops to everyone in BC, to her family, to her friends, and to her colleagues. And Captain Richard McDougall, who sustained serious injuries. Tragedy was felt in Kamloops, it was felt everywhere in Canada, and we wanted to both acknowledge and pass on our genuine sense of sorrow. And also to thank the health care team at Interior Health, the first responders, the ambulance paramedics, the BC Emergency Health Services team, the Kamloops firefighters, the Kamloops Airport Fire Rescue, the Kamloops RCMP, and of course the people of Kamloops for their response and for their support, and to Mayor Christian as well. Les snowbirds des Forces canadiennes effectuaient une mission unique, baptisée Opération Inspiration. Et comme vous le savez, une journée vraiment terrible pour toutes les personnes impliquées hier, et une perte déchirante pour la famille, les amis et les collègues du capitaine Jennifer Casey, qui est décédée de cet accident tragique, et du capitaine Richard McDougall, qui a subi des blessures graves. Cette tragédie est ressentie par tous les Canadiens, ressentie à Kamloops et dans tous les coins de ce pays, du pays. I also wanted to acknowledge that we're here an honor to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. I wanted to say that tomorrow, Dr. Henry and I will be providing a briefing on COVID-19 here at 3 o'clock. On Wednesday, we'll be releasing a written statement, also at 3 o'clock, and then on Thursday again, we'll be providing an additional briefing. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. So we are updating the cases today for 2 reporting periods, Saturday, May 16th to Sunday, yesterday, and then yesterday through midday today. On both days, we have 8 new people who have tested positive for COVID-19. So that's 8 on Saturday and 8 again in the past 24 hours, giving us 16 new cases, bringing our total in British Columbia to 2,444 people who have tested positive for COVID-19 in the province. That includes 882 people in the Vancouver Coastal Health Region, 1,195 in the Fraser Health Region, 126 people on Vancouver Island Health Region, 181 in the Interior Health Region, and 60 people in the Northern Health Region. We continue to have 19 active outbreaks in our healthcare system, including 14 in our long-term care or assisted living homes and 5 in acute care units. There are no new healthcare or community outbreaks, and we have one more that has been declared over in the Fraser Health Region, and that is the outbreak that was at the Dufferin Care Centre. We now have 528 people from long-term care, assisted living, or acute care who've tested positive, including 326 residents and 202 staff. We now have 335 active cases around the province, and they are continually in all areas of the province. Of those, we have 47 people who are hospitalized, and there are 12 people in critical care and ICU right now. Over the last 2 reporting periods, we've had an additional 2 people who have died from COVID-19, bringing that total to 143 people here in British Columbia. And again, both of these people were in long-term care, one in the Fraser Health Region and one in Vancouver Coastal Health. And our condolences go to their families and to the care teams and their communities. We have 1,966 people who are now fully recovered from COVID-19. I also want to take a minute to recognize the tragic events that happened in Kamloops yesterday involving a member of our Canadian Armed Forces, our Royal Canadian Air Force. And today we pause and remember, and we extend our heartfelt sympathies to the family and friends and co-workers of Captain Jennifer Casey. And of course, the Canadian snowbirds, and we know that they bring Canadians together, and this is a loss that will be felt by all of us. And we thank the snowbirds and the Royal Canadian Air Force and all of the Canadian Armed Forces for the work that they do to support us across the country. And we stand beside you with our hands on our hearts in sorrow and in strength. And I would like to as well give my condolences to the family of Captain Richard McDougall and hope that he makes a full and speedy recovery. I think perhaps we might have some solace in knowing that Captain Casey maybe truly has slipped the surly bounds of earth and is dancing the skies. I'd also like to start with telling you an update about our province-wide survey about people's experiences of what has happened over the last few months, called Your Story, Our Future. We now have more than 260,000 people who have completed the survey so far. We still would like to hear from more, particularly from more seniors, for people who live outside our major urban centres, and people from different cultural backgrounds around the province. The survey is available online and by phone, and I know there has been some concerns about people when they access the BC CDC website that the certificate says it's not a secure website. I can assure you that the survey is linked directly to a secure website, and the survey results are absolutely in a secure site, and we have done a complete analysis of that to be reassured that that is the case. I've also had questions from some people asking why we're asking a number of questions on the survey, including asking about things like age and sex, education level, income, race, and ethnicity. It is really important for us to understand not only who's been affected directly by COVID-19, being infected, but also the impacts, the measures we have taken across the province affect different groups. And that is why it is important for us to understand how different groups of people have been affected when questions like age, sex, ethnicity, income, education, all of these are very important so that we can ensure that if some groups are being more affected or less affected, we're able to ensure we have what they need to be able to support them. Oof. I know as well that the physical, financial, and emotional strain of what we have been through in the last few months has been difficult for everybody. And we're all now trying to understand what this means when we're going to our phase 2 starting tomorrow. For many, the transition brings anticipation, but it also, for many, brings further apprehension and anxiety as schools and businesses look to open once again. We are still learning the new ways of safe social interactions and doing things that we've never had to do before, and that in itself can create anxiety and concern. I know that even me trying it out yesterday had some challenges. I had a small number of friends over, and we sat outside at an appropriate distance from each other, but it was a bit awkward and strange. And a little bit anxiety-provoking, not having socialized for several months. And I know the stress of this can be much more challenging for some people, and some people it can have a harmful impact. I want to say again, and we've talked about this before, if you are a victim of family or partner violence, support is available to you 24 hours a day, 7 days a week, through Victim Link BC, 1-800-563-0808. And for youth who may be having challenges with the emotional struggles related to COVID-19, related to the interruptions in your schooling and the other things that are going on. The Kids Helpline is available by phone, by text, and online, and I would encourage you to call it. It's 1-800-668-6868, or you can text 686868, or thekidshelpphone.ca. And for all the rest of us, we need to continue to show that patience and compassion that we have had, both for ourselves and for those around us as we entered this new phase. We need to continue to think about consideration and generosity and respect for others. That is what will get us through. With the easing of restrictions and the added social interaction, the potential for a flare-up in new cases does go up, and we have seen that in places around the world. And us in public health, we will be watching very carefully, and we will ensure that we have the testing, the contact tracing, and the ability to manage any new cases that we see. But we all have to move carefully and stay alert. Every day we can and must do our part to continue to hold the line on COVID-19. So pause and think about how you are going to keep yourself and those around you safe. If you are using transit or going into a smaller store where keeping a safe physical distance might be more challenging, those are the times where we can consider wearing a cloth face mask to protect others. Simple things can make a big difference. I have to say, though, only you know your own risk for your family or for your business and the precautions that you need to take. If you do have somebody in your family who's going through cancer treatments, if you have somebody who is ill, if you have elderly members of your family who are anxious and concerned, you may need to take more precautions and continue to do the measures that you have been doing. We may not always get it 100% right all the time as we're moving forward, but that's okay. We're not alone. We are all in this together, and we will work through this together in the next few weeks. I will say one thing. I know it has been particularly difficult for people who have had loved ones in long-term care or in acute care in the past few weeks and months. And I received many, many emails and letters about people's individual situations and requesting that I intervene. As much as I empathize absolutely with every individual case, I simply cannot interfere in decisions made by an individual care team, and nor would it be appropriate for me to. But I do want you to know that we hear you, we know this is a challenging time for everybody, and that there is a place for you to connect, and that's with the Patient Care Quality Council offices in each of the health authorities, and they are there to support you for your individual needs through this. Our well-being and our future is still in our hands, and we must continue to watch them, and we must continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. And I wanted to start by echoing the condolences of Dr. Henry to the two people who passed away from COVID-19 this weekend, from Saturday to Sunday this weekend, one in Vancouver Coastal Health and one in Fraser Health. As Dr. Henry just said, these are very, very challenging times. For example, in long-term care, difficult for families and difficult for everyone, difficult times to be going through this. And obviously, just a terrible time to have someone you love pass away. So we wanted to, again, support people in their sorrow, in their grief, and to give our condolences to the family, to the friends, and the caregivers of those who passed away. As noted, there are now 47 people hospitalized with COVID-19 in BC. That's 24 in Fraser Health, 1 in Interior Health, 1 on Vancouver Island, 2 in the Northern Health Authority, and 19 in the Vancouver Coastal Health Authority. As Dr. Henry has said, 12 of those people are currently in critical care, and obviously these numbers are down from where they were at the early part of April, the high of 149 hospitalized. We're at about just over a third of that, and the high of 72 in critical care, and we're at about 1/6 of that high as we speak. There are continue to be about 2/3 occupancy rate, 67% occupancy rate in our hospitals around BC, about 50% occupancy rate in our critical care units. in the last number of days, we've continued consistently at a new level of emergency room visits. It changes somewhat every day, but it's been between about 4,700 visits and 5,200 visits for the last week. Want to express our appreciation to the 260,000 British Columbians who so far have taken the survey and encourage more to do so. It shows the level of engagement, I think, by British Columbians with all the ways that they can get involved in defeating and helping in the COVID-19 pandemic in BC. We note that more than 3.25 million visits or self-assessments have been done with our self-assessment tool, and that we have about 208,000 people who are users of the app, the COVID-19 app that's been provided. So that shows the level of interest, support, and engagement people have. I want to continue to encourage people to use 811, where there are essentially no wait times now. If people are seeking medical questions, whether it's about COVID-19 or anything else, we get approximately 2,000. It's come back down to 2,000 calls a day on the 811 line. All of them essentially are being answered, and the wait times are well under 30 seconds now, which was obviously a significant achievement by the people involved. Just to put it in context, at the beginning of this, prior to COVID-19, there would be about 1,200 calls a day. It went up to close to 6,000 calls, and now it's at about 2,000 calls. So there is and continues to be the ability to do that. I want to thank people in BC in this long weekend that we're at, which is a significant long weekend in the year, for continuing, I think, overwhelmingly to follow the advice of Dr. Henry, to follow the advice of medical health officers, and to maintain physical distancing. There's a lot of discussion. There's always a long discussion in each of the long weekends. There was an Easter, and there is now about travel on a long weekend. We do have some numbers from BC Ferries, just to put it in context, that on the major routes in 2018, from Thursday to Sunday of the Victoria Day weekend, there was 163,578 passengers. This weekend, in the same period, there's 32,921. On Route 3, which is Horseshoe Bay to Langdale, 23,586. This weekend, 7,649. In the Southern Gulf Islands, 15,424. This 2 years ago, this weekend, 4,065. The other minor routes, 54,231 to 17,781. And in the north, 1,017 in 2018 to 118 this weekend from Thursday to Sunday. I think this indicates that while obviously there is travel going on in the province, that people have been mindful of the guidance they've received. Obviously, as well in BC Ferries, there's a reduction in the capacity on the ferries, which has reduced ridership as well. But I think it's important to acknowledge that all that's gone on. I would say, just in general, on the long weekend, it's just observation that we mostly stayed close, we stayed apart and stayed safe, and we kept our highways and ferries clear for the most part for those doing essential travel. Phase 2, as Dr. Henry has said, as you know, starts tomorrow, and through our efforts this weekend to stop the spread, we're giving our social, surgical, and economic renewal the strongest chance for a great start. But let's be clear, despite the changes we will see around us starting tomorrow, what we won't see is the most important fact of all. COVID-19 is still with us in every single health region in this province. Phase 2 is about increasing our rate of contact to about 60% of what it was before COVID-19, a doubling of the contacts we've had up to this point. What does not change, what will not change for months, is that for us to travel safely from and through the recovery phases, we must continue to carry our passport to safety with us at all times. That means the skills we've been taught to stop the spread of COVID-19 stay with us every step of the way, every moment of every day, no matter what phase we're in. Throughout this summer and well beyond, physical distance remains our constant companion. Physical distance, along with washing our hands, coughing and sneezing into our sleeves, staying home if we're sick, respecting and supporting engineering and administrative safeguards like acrylic barriers and crowd control, and using non-medical masks when appropriate, will protect us, our employees, our customers, those who care for us, and those who we love. Our ongoing discipline, with the same rigor in our practices we've demonstrated so far, ensures we stay 100% committed to stopping the spread and 100% all in our BC effort. All these skills we've learned pose challenges and limit some of the traditional ways we've interacted with one another. Sticking with them now will give us every opportunity to make this a summer that renews BC and makes us stronger together along the way. Aujourd'hui, nous faisons le point sur le nombre des nouveaux cas pour 2 périodes de référence de 24 heures chacune, soit celle du 16 à 17 mai et celle du 17 mai jusqu'à 18 mai en mi-journée. Pour la première période de référence, qui s'étend jusqu'au 17 mai, nous avons eu 8 nouveaux cas. Au cours des dernières 24 heures, 8 nouveaux cas se sont ajoutés. Cela représente 16 nouveaux cas depuis notre dernière mise à jour samedi pour un total de 2444 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19 dans la régie de santé de Fraser et un dans la régie de santé de Fraser et un à Vancouver Coastal, pour un total de 143 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant la pandémie COVID-19. Parmi l'ensemble des cas confirmés de COVID-19, 47% sont actuellement hospitalisés, dont 12 en soins intensifs. Thank you very much. Merci beaucoup. Happy to take your questions.
Thank you. As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to 1 question. Please also unmute your phones. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good day. The recent outbreak at the ICU in Abbotsford and the renewed outbreak or second outbreak at the Langley Lodge, I wonder if you've been able to determine the origin of these two and whether or not it was related to healthcare workers moving between multiple facilities, please.
Yeah, as far as I'm aware, it's not due to people moving between facilities. The investigation, of course, is ongoing, but it is related to unrecognized illness in healthcare workers and also in patients in the ICU case. So, it's the challenging thing that we have. And I mentioned this before, this virus can be very subtle in some people, particularly if people are in hospital with illness for other reasons, and it may go unrecognized. So that is a challenge we face. And why it is so important for us to have done what we did to reduce the burden of the pressure of illness in our healthcare system, because it allowed us to, for the most part, recognize cases early, make sure that healthcare workers had the time they needed to make sure they could respond and use the appropriate PPE. But unfortunately, in this case, an unrecognized case and then transmission between some staff members.
Next question is from Cindy Harnett, Times Colonist.
For taking my call. Dr. Henry, you broached how difficult it's been for people and families related to long-term care. What needs to happen before seniors in care homes and patients in hospitals can have perhaps at least one visitor? And when do you see that happening, if at all, this summer?
Yeah, I do see that happening, and it will take us continuing to control the virus both in the community and in our long-term care homes and in our hospital settings, and we have seen a decrease. What the challenge, of course, becomes everybody wants to have their one, and so we need to make it in a way that is safe for the rest of the community, and that really what each of these, particularly in our long-term care homes, they're a community as well. So it has to be a way that allows that staff feel safe, that they can manage to support people to come in with their loved one and to provide that support to their loved one. So I know they are working on it, and it may look slightly differently in different facilities depending on how many people there are per room, what type, how large the facility is, and that sort of thing. But I do expect that I'm hopeful that it will be sometime maybe in June as we see our numbers decrease, and a lot of it will, of course, depend and our ability to keep control of this virus in our community and our long-term care homes. So that's the paramount thing right now. If all of us do what we have been doing and we continue to be thoughtful and careful as we move through the next few weeks, I'm very hopeful that starting later on in the summer, we should be able to make those incredibly important essential visits more available for family members and for our seniors and elders who really do so need them.
Megan Batchelor, CBC.
Hi there. Thanks for taking my question. As we go into phase 2 tomorrow, how concerned are you about more cases popping up? How will we know when it's working? What will that look like?
Yeah, so we know the incubation period for this virus is 2 weeks, so we will be watching very carefully, as we have been doing. So as you know, we've expanded testing so that it's available to anybody with symptoms. We are finding cases in the community, and we are linking them. So that is the thing that we will continue to do in public health. Our contact tracing resources are ready to go and are working full time. And so, yes, we will, part of it will be ensuring that we are able to test wherever it's needed. And I think we have that capacity now around the province. We'll be watching very carefully for new cases as they come up. As businesses and retail stores and salons start to reopen, there's an onus as well on you, on all of us, to ensure that we're monitoring very carefully for symptoms, and we do not go into work, we do not go visit our hair salon if we are feeling the least bit unwell, and that we are able to be tested. So those are the things we'll be watching. And of course, when school starts again in classroom schooling in a limited way, albeit in June, we'll be watching very carefully there as well.
Laura Brom, CFAX.
Hi. So on Friday, the education restart plan was announced, and it said people who are sick will not be allowed in school. And so in phase 3, busing is planned to be reintroduced. So I was wondering, for students who are taking the bus to school, will bus drivers have the authority to say, sorry, you're presenting with illness, like you're sneezing and coughing, so you're not allowed on the bus? Or is it only once the student gets to school that school administrators have the authority to say, sorry, you're not allowed in school today?
Well, I think it would be a conversation with the parent and the child if the bus driver noticed something, absolutely. There's no authorities that I'm aware of in that sense, but yes, we would expect that parents will have that conversation with their child and make that determination before they send their child to meet the school bus. And also, that's a place where bus drivers may have the ability to test, to tell, but may not. And so it will be, people will be asked again about health as they come into the school. So there's different places, but it really is about having that low sensitivity, and if you're not feeling up to it and you're not feeling well, to stay away and stay home.
Next question is from Shruti Basu, Victoria Buzz.
Hi, everyone. Thanks for taking my question. Dr. Henry, you talked last week about how outdoors is better than indoors and provided some examples of social interactions. I was just wondering, what is your direction on casual outdoor sports that involve contact, like soccer and basketball? Like, can a group of kids go to the park and enjoy a casual game?
Yeah, so those are some of the more formal things. We're still working through the details of how to make them work come the period where we start to see more organized sports, but we are seeing some of that right now. What we want to say is small groups, right? So if you're going to have a casual game with some friends, fine, but avoid the close contact with a lot of people. So small numbers, we're saying, keep it to 2 to 6. Outdoors is good. Maintain your distance. The other thing that we have to factor in is time. So if you're coming close with somebody for a brief fleeting second, that's not as risky as spending a lot of time in close contact with them, even outdoors. So those are the things that we need to pay attention to right now. And the bottom line is we don't want congregating of large groups, because that's where we know this virus can be spread, and we've seen examples of that, mostly in indoor settings, but some outdoor settings.
Next question is from Lisa Cordasco, CHLY.
Thank you. Minister, you mentioned earlier about the BC Ferries numbers. What about the sort of checks that went on, at least some on Vancouver Island, by the BC Conservation Service and the RCMP, you know, talking to people about things ranging from fishing licenses to whether they were planning on camping overnight. Do you have any numbers on how many people were advised, you know, not to do that, or were any fines of any type handed out? And also, you know, can people camp right now on Crown land? And if so, are you considering having a ban on that until overnight camping opens in provincial parks?
I think rather than trying to answer, Lisa, I'll get that information for you, and perhaps we can either report on that tomorrow, or more likely I'll ask Minister Heyman to report on that, and we'll get you some of the information about what's been going on in this first period since the reopening for day use of BC parks.
Next is Keith Baldry, Global News.
Hi, Dr. Henry. Just a question of clarification about your public health order on restaurants and pubs and such. The 50% capacity, maximum capacity rule, obviously a number of restaurants aren't going to be able to meet that in terms of being able to survive. So what's the 50% based on? And a clarification, the tables have to be 2 meters apart, but from what I read, the maximum 6 people around a table aren't necessarily 2 meters apart. Is that correct?
That's correct. Yeah, so, you know, this is based on, there's not a lot of science. It's based on trying to put together a rational approach to how many people would create enough of a crowd that we would put others at risk. And part of it is, you know, being able to find that physical space. So for many people, depending on how your restaurant is configured, to be able to have the space between tables that allows for that, you won't be able to make 50% of capacity. But we needed some limits, and it was around congruency with other gatherings, for example, events where 50 seems to be a reasonable number. As I've said from the very beginning, there is not a lot of science. We're sort of trying to figure it out with things that we know could make a difference in prevention of transmission of this virus. So I've talked to my colleagues across the country. Many of them have gone to smaller numbers and are continuing with smaller numbers. We've stuck with our mass gathering at 50. This is a slightly different situation, but it just, you know, it seemed like a reasonable approach in conversations with industry. It was something that gave a little bit of a limit around the number of people that could be in a place at a time. And we will be, you know, this is for this phase. So this is to encourage people to take it slowly and to look at how we can do this and monitor carefully to make sure that we're not creating situations that allow this virus to be transmitted rapidly in our communities again. So we will be looking at it again as we move through this phase and find out if, you know, we'll be willing to take direction from industry as well about how it's working and what we can do to tweak and to manage things as we go forward.
Nick Wells, Canadian Press.
Hi, thanks for taking my question. I'm just curious what you would say to businesses who are opening again tomorrow but are kind of concerned about how they'll handle all these new health precautions.
Yeah, I would just say take it slow. You know, they're here, we're here, WorkSafe BC, the environmental health officers in your local public health unit are here to help guide you in this. But we know, and I know absolutely there's anxiety on both sides, and there's anticipation on both sides. So people are looking forward to getting back into the environment, but many people are a little bit afraid. So this is our way to say, here's what we're doing. We're going to err on the side of being as careful as we can. We know the things that work are keeping the safe physical distance as much as possible, making sure that we have hand hygiene, reducing the number of people in there, and having multiple occasions to be able to ensure that anybody who comes into our space is not ill themselves. And that's a really, really important thing for all of us to consider. So it is going to be a bit of a anxiety-provoking week for many, many people. And then we'll get used to it. We've gotten used to some of these social interaction restrictions that we've had. We've gotten used to how to get through a grocery store in a way that doesn't put others at risk. We will get through this as well. But for this week, you know, take it slow.
Next question is from Frushi Gangdev, CKNW.
Hi, Dr. Henry. I'm just wondering, you mentioned you're asking people of a variety of cultural backgrounds and ethnicities to respond to the survey. When that information is received and analyzed, will you be releasing that and using it to inform the province's response?
Yeah, so there are questions, and some people ask me questions about why we've included those types of questions in the survey. And it really is because unless you look at it from that perspective, you don't know if there is something that we're missing about who is being affected, either in a positive way or a negative way, both by the virus and by the effects of the restrictions that have been put in place. So it is really important. We know that that there is associations between poverty and health. There is associations between certain ethnicity and racial groups that have had impacts on people's health. So that's why it is important for us to use that information. We obviously will not be releasing it in any way that would identify any individual, but it is a way of helping us understand the differential impact in different communities and different populations across the province, and that's why it's so important. In the same way that we need to understand how it affects people at different age, these are also important things that help support health. And we talk about the social determinants of health, and those are the ways that we measure those social determinants so we can understand where we need to put the resources to support people.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today with all the information covered off. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Nick Sweetman, CHLY.
In March, fatal overdoses in BC increased by 61% compared to February. March also saw 7,000 fewer visits to overdose prevention sites and safe consumption sites. Can you tell me what's being done to increase access to OPS and SCS sites and encourage people who use drugs to visit them? And also, if you know anything about the fatal overdoses or SCS use for April and May.
Yeah, we don't have the final numbers for April and May, but this is something, of course, that I watch, and we have a weekly report that we've been looking at. There's been a whole number of factors that have led to the numbers that we saw in March, and believe me, these are important things that we have been following, and there is a plan. Some of the OPS did shut down their services, reduce their services quite a bit, particularly early on in this when we were trying to figure out how to best protect people, both the people who worked in the OPS and our peer support groups in the OPS, as well as people who use drugs in those settings, safe settings. I will also note that we still have not had any deaths at the overdose prevention site or supervised consumption sites around the province. There has been modifications that have been made that have allowed them to expand their services again. And we know that in several communities, like here in Victoria, other types of provision of overdose prevention services have been made. So they went from their one standalone place to having mobile overdose prevention services because of the way that the challenges we were having with the shelters, for example, and people being more dispersed around the province. So we've seen a number of different things. The other thing that I am very concerned about is, of course, the increased toxicity of the drugs on the street right now, and a lot of that has to do with the difficulty in getting that it's been more challenging to get some of the drugs into the province, which means that they're being cut with different things or being attempted to be manufactured within the province. And that has led to an increased toxicity, which of course is part of the tragedy that we're seeing in the last little while. So we have seen both an increase in severity and we've seen clusters of overdoses, even when overdose prevention services were available in those areas. So it has been a work in progress. I think one of the key important things that we have been doing around, particularly around Topaz Park here and Pandora and Oppenheimer Park, is moving people into more safe shelters in where they have their own room and their own bathroom. That makes it safer for them. But then making sure that we have those overdose prevention services so people are not using alone in those settings. And that's a big challenge, as we all know. We also know that that over half of the overdoses happen in young men who are using alone at home, and this is still another very challenging thing to get people to, when we're all isolating, to have somebody that they can reach out to. And I know there's been a couple of initiatives like using apps to support people who are using alone. The other thing that is incredibly important, we came out with safer supply guidance, and that has been moved out around the province to various different degrees. It's been a challenge, and that is something that we are continuing to focus on, making sure that people who use drugs are able to access safe, regulated or safe pharmaceutical alternatives to what we know is an incredibly toxic street supply. So that initiative also continues.
That's all the time we have for today. Thank you.
Thank you very much.